If you're in healthcare, you live with this constant tug of war, don't you? On one hand, you're driven to provide the best patient care possible. On the other, you've got to keep the lights on and make sure the practice is financially sound. Today, we're going to dig into how one company, Evrostos Health, is laser-focused on solving that exact problem by creating what they call system integrity.
So, here's our game plan. First, we'll really unpack that core challenge that every practice is facing. Then, we're going to look at the Evrostos solution, which is kind of two-sided, how they lock down the financial side of things, and how that, in turn, boosts patient care with technology. And finally, we'll see how it all clicks together to create this incredible, self-sustaining advantage.
All right, let's dive right in. Let's talk about the big challenge, this constant balancing act that pretty much defines what it's like to work in healthcare today.
At the end of the day, it all boils down to this one really tough question. Do you focus on giving amazing patient care, or do you focus on keeping the business profitable? For so many, it feels like you have to choose. And that impossible choice is a direct line to burnout and, honestly, compromises in care.
Think about it like this. On one side, you have your mission, right? Delivering incredible patient outcomes. That's the why. It's why you got into this field. But on the other side, you've got this mountain of financial and administrative headaches. Every single hour you spend wrestling with billing codes or compliance paperwork is an hour you're not spending with patients, and that directly chips away at the quality of care.
So how in the world do you break out of that cycle? Well, the answer isn't just another piece of software or a new tool. It's a totally different mindset, moving away from just hiring vendors and toward building a real partnership.
And that is exactly what Evrostos Health is all about. Their entire model is built on this idea of system integrity. They create an environment where the clinical side and the financial side of your practice don't just put up with each other, they actually fuel each other, driving real, sustainable growth and way better outcomes.
Okay, so let's see how this actually works, starting with the financial bedrock. Because let's be honest, without a solid business foundation, even the most passionate clinical mission is going to struggle.
Evrostos builds that foundation using three main services. First, there's Comprehensive Revenue Cycle Management, or RCM, which is basically the financial lifeblood of any practice. Second, they have specialized billing for skilled nursing facilities, which, have their own super complex rules. And third, they offer custom software support to make sure your tech is actually helping, not causing more headaches.
Now, a successful revenue cycle is so much more than just sending out a bill and crossing your fingers. It's a proactive, four-step dance. It all starts by scrubbing claims to find and fix errors before they even go out the door. Then it's about diligent follow-up to make sure payments come in on time. When denials do happen, and they will, they're managed and appealed by experts. And finally, you get all this great data and analytics to see what's working and fine-tune the whole process. It's all about maximizing every dollar.
And here's the kicker, the really crucial part. When your revenue cycle is optimized, it does more than just help your cash flow. It creates freedom. It unlocks the money you need to invest in that new piece of medical tech, to hire more staff, and to really innovate how you care for your patients. A healthy bottom line directly powers a stronger clinical mission.
So, with that stable financial base set, you now have the perfect launchpad for the other half of the equation, taking patient care to the next level. And today, that means using technology to completely change how care is delivered. Evrostos brings in technology that helps you shift from being reactive to being proactive. With remote patient monitoring, you can track a patient's vitals while they're at home, catching problems super early. Chronic care management gives dedicated, ongoing support to patients with long-term health issues. And they even do custom software development to tie all these tools together so data and communication just flow.
I mean, just look at the difference here. This shows the huge shift in the care model. Traditional healthcare is reactive, right? A patient feels sick, they call you, they come in for a visit. But with tools like RPM and CCM, care becomes proactive. You're watching their data constantly, you're engaging them between visits, and you're stepping in before a little issue becomes a full-blown emergency. And this proactive approach, it's a massive win-win. Patients get better long-term health and have fewer scary emergencies. And for the practice, you're reducing expensive hospital visits, boosting your quality scores, and just operating more efficiently. It perfectly aligns the financial incentives with the best possible outcomes for the patient. It's awesome.
So, we've talked about the financial pillar and the clinical pillar. But the real magic of the Evrostos model isn't just in those services by themselves. It's all about how they connect to create this powerful, virtuous cycle. This is where it all clicks into place. Look, strong financial management through RCM boosts your revenue. That extra revenue frees up capital to invest in cool clinical tech, like RPM. That technology lets you provide proactive care, which cuts down on costly emergencies and improves patient health. And what's the result? A practice that isn't just surviving, but thriving. This right here is system integrity in action. Financial health makes clinical excellence possible.
So, who is this integrated model really for? Well, this isn't some off-the-shelf product. It's a partnership designed for specific healthcare organizations that are really ready to grow and evolve.
The ideal partners usually fall into one of three buckets. You've got private clinics that want to scale up without getting buried in paperwork. You've got long-term care facilities trying to navigate that tricky world of skilled nursing billing. And really, it's for any growing healthcare team that gets it, that understands you need a rock-solid operational backbone to support your mission of patient care.
I think this quote just says it all. Evrostos isn't trying to come in and replace anyone. It's all about partnership. The whole goal is just to lift that heavy administrative burden off of providers' shoulders so they can get back to focusing 100% on what they got into this business to do: care for patients. And that really brings us to the final and maybe most important question. Just imagine for a second, if all that friction between the business side of medicine and the practice of medicine just disappeared. What could your practice achieve? What new innovations, what new levels of care would suddenly be possible if you had total system integrity? It's a pretty powerful thing to think about for the future of healthcare.